think for a moment about all the sounds around you, a voice, music, maybe your pet making noise. Sounds really connect us, don't they?
They absolutely do. It's a fundamental sense.
So what happens when that connection, well, weakens or disappears? Especially for our animals, our dogs and cats.
That's a really powerful question, and
Yeah.
it sets up exactly what we're exploring today. We're doing a deep dive into the complexities of deafness in pets.
Right.
We've gathered quite a bit of information, and the idea is to really unpack what is hearing loss in animals
Hmm.
and the why, the causes.
And also so what, I guess. What does it
No,
mean for owners?
precisely. What are the implications if you're caring for an animal with hearing loss?
Okay, so first things first. Deafness isn't just silent or not silent, is it? It sounds like there are nuances.
Exactly. It's not black and white. We talk about partial hearing loss versus complete loss.
Okay.
And then fundamentally, there are two main categories we need to understand: sensorineural deafness and conduction deafness.
Sensorineural and conduction. Okay, what's the difference there in simple terms?
Well, think of sound traveling into the ear. Conduction deafness is like there's a roadblock, something physically stopping the sound from getting through the outer or middle ear properly.
Like a blockage.
Yeah, or maybe a problem with the eardrum or the little bones behind it. Sensorineural, on the other hand, is deeper. It's an issue with the inner ear itself, the cochlea, or the nerve pathways that carry the sound signal to the brain.
Okay. So conduction is the pathway. Sensorineural is the processing machinery.
That's a great analogy, yes. And when we talk about sensorineural deafness, especially in young animals, genetics often plays a huge role.
Genetics. How so?
Well, this is where it gets fascinating. It's often tied to certain coat patterns, specifically the Merle and Piebald genes.
Merle and Piebald. Those are the ones that give those like dabbled or patchy white coats,
Yeah,
right?
exactly. Beautiful patterns. But the genes responsible, or certain versions of them, recessive alleles, don't just affect coat color. They can also impact pigment-producing cells called melanocytes.
Okay. Melanocytes. They make the color.
Right. But they're not just in the skin and hair. They're also found in a really critical part of the inner ear called the stria vascularis.
Stria vascularis. Never heard of it.
Think of it as like the battery pack for the cochlea, the main hearing organ. It nourishes the sensitive hair cells that detect sound.
Got it.
If the melanocytes in the stria aren't working right because of those pigment gene variations, the stria can degenerate, often very early in life.
Wow. So the battery fails and then the hearing mechanism.
It can lead to the degeneration of the hearing cells themselves, yes, leading to deafness.
That's incredible. The same gene for a coat pattern affects inner ear function. Are there specific breeds we see this in more often?
Oh, definitely. The information points to quite a few. We see higher rates in breeds like Catahoula leopard dogs, dappled dachshunds. Dalmatians are probably the most famous example.
Like the spots.
Yes. Also, Jack Russell Terriers, Australian cattle dogs, bull terriers, particularly white ones, English setters, English cocker spaniels, border collies, even whippets. It's a surprisingly long list.
And you mentioned Merle specifically. Is it worse if they have more of that gene?
Absolutely.
Yeah.
Dogs that inherit the Merle gene from both parents, as we call double Merles, have a significantly higher risk of deafness.
So inheriting two copies is much riskier.
Dramatically so, yes.
Yeah.
But it's also important to note, not all hereditary sensorineural deafness is linked to pigment. Our sources mentioned Doberman pinschers, for instance. They can have hereditary deafness that isn't associated with these specific coat color genes.
Okay, that's an important exception. So that covers the genetic side of sensorineural deafness. What if a pet loses hearing later in life?
Good question. That brings us to acquired sensorineural deafness. This isn't something they're born with, but rather damage that happens over time.
What kind of damage?
A whole range of things, really. Think about chronic ear infections, especially if they get really bad and affect the inner ear. Then there's ototoxicity, that's hearing damage caused by certain drugs or toxins.
Ototoxicity. Sounds serious.
It can be. We'll touch on that more. Also, tumors near the ear or affecting the auditory nerve, exposure to really loud noises over time, sometimes complications from anesthesia, and, well, just aging. Like in humans, hearing can decline with age. That's called presbycusis.
You mentioned ototoxicity. What kind of drugs or substances are we talking about? That seems like something owners should know.
Definitely. The list includes certain types of antibiotics, particularly a group called aminoglycosides.
Okay.
Also some antiseptics used in ear cleaners, certain cancer drugs, diuretics like furosemide, which is common heavy metals, and other miscellaneous agents. It really highlights why it's crucial to use medications only as prescribed. and discuss potential side effects with your vet.
Absolutely. Good reminder. Okay, let's switch gears back to the other type, conduction deafness, the blockage kind.
Right. So being born with conduction deafness, congenital conduction issues is actually pretty rare.
Oh,
There is one specific hereditary condition mentioned in Cavalier King Charles Spaniels, related to something called primary secretory otitis media, or glue ear, which affects the middle ear.
ah, Cavaliers. They do seem prone to certain things, unfortunately.
It seems so, but acquired conduction deafness is much more common. This is usually caused by physical problems in the ear canal or middle ear.
Like what?
Things like the ear canal becoming very narrow stenosis or blocked by, say, wax buildup, foreign objects, or even tumors. A ruptured eardrum is another one. Or sometimes the tiny bones in the middle ear, the ossicles, can kind of fuse together and stop vibrating properly.
And what usually causes those problems?
Very often, it's linked back to chronic ear infections, otitis externa, which is the outer ear canal, or otitis media, the middle ear. Middle ear polyps can also cause blockages.
So, a really bad or recurring ear infection could potentially lead to permanent hearing loss if it causes these physical changes.
Yes, that's definitely a risk.
Ah,
Untreated or persistent otitis is a major factor in acquired conduction deafness.
okay. So, pulling this together, the main system affected is obviously the auditory system, inner ear, nerves, brain pathways.
Correct.
And we've seen this strong link, especially for congenital deafness, with those piebald and Merle genes affecting pigment.
Exactly. It's a really clear example of how genes involved in one trait, like coat color, can have unexpected effects on a completely different system, like hearing.
It's fascinating biology. You gave some breed examples, but do we have actual numbers? Like, how common is this?
Yeah, we do have some statistics, and they really drive home the impact of the Merle gene. For dogs with just one copy of the Merle allele, the prevalence of deafness in at least one ear is around, say, 3.5%.
Okay, not insignificant.
But for dogs with two copies, the double Merles we talked about, that number jumps dramatically. We're looking at roughly 25% prevalence of deafness in one or both ears.
Wow, 25%. That's a huge increase. What about piebald?
The genetic link for piebald is also significant, though a specific commercial test for that deafness link isn't as readily available as for Merle. But we know it's a major factor, especially in breeds like Dalmatians.
And the Dalmatian numbers, you mentioned them earlier.
Right. In the U.S., the reported prevalence in Dalmatians is around 30% for deafness in one or both ears. Interestingly, it seems to vary geographically in the U.K. The figure reported is closer to 18%.
Huh, geographic variation. That's interesting. Any other specific breed numbers?
Yes, the sources list quite a few. Catahoula leopard dogs have a very high reported rate, around 63%. Dappled dachshunds, about 55%. Others mentioned include Jack Russell Terriers, Australian cattle dogs, Bull Terriers, especially the white ones, maybe 20% English Setters, English Cocker Spaniels, Border Collies, Whippets.
Right.
The prevalence varies in each.
And cats, you mentioned them at the start.
Yes, purebred white cats have a prevalence of congenital deafness around 20%.
So quite a few breeds and even coat types are flagged. Beyond the specific breed, are there other characteristics, what vets call signalment, that are associated with higher risk?
Definitely. So congenital deafness linked to these white pigment genes, Merle or piebald, has been described in well over 90 breeds.
90.
Yeah. But remember those exceptions we mentioned, like Dobermans, Pulas, Shropshire Terriers, where it's not pigment related?
Right.
Typically, if it's congenital sensorineural deafness, it's present pretty early, usually detectable by about 6 weeks of age.
Okay.
Interestingly, it doesn't seem linked to gender. Male or female doesn't make a difference. Nor is it linked to other coat color genes, only Merle and piebald specifically.
What about eye color? Does that play a role?
It can, yes. Dogs with blue eyes, especially in combination with these coat patterns, seem to have a higher risk of congenital deafness.
And in cats?
In cats, it's particularly noted in non-purebred white cats.
Yeah.
With the blue eyes, they have a high incidence. Interestingly, it's lower in purebred white cats like Persians or Turkish Angoras that have the Siamese gene causing their blue eyes. That seems protective somehow.
Fascinating difference there.
And of course, acquired deafness, the kind that develops later that can affect any breed, any age, any color.
Okay, so if you have, say, a Dalmatian puppy or a double Merle Aussie, what signs should you actually look for? How would you know if they might not be hearing well?
That's a really practical question.
Mm-hmm.
Often, if a pet is deaf in only one ear unilateral deafness, it can be really hard to notice.
Because they compensate.
Exactly. They still hear perfectly well with the other ear. The only subtle sign, Might be difficulty pinpointing exactly where a sound is coming from, but even that's rare to spot.
Okay.
The signs become much clearer if they're deaf in both ears, bilateral deafness. You might notice they don't respond when you call their name, or to familiar sounds like the doorbell,
Mm-hmm.
or, the food bag rustling.
Right, things they'd normally react to.
Exactly. They might also startle very easily, especially if you approach them from behind or wake them up suddenly.
Because they didn't hear you coming.
Precisely. And you might observe them becoming much more reliant on visual cues, watching your hand signals maybe, and noticing vibrations more.
That makes sense. They adapt using their other senses.
Okay, let's circle back to the causes. Maybe dig a bit deeper into the why for both types.
Sure. So for sensorineural, again, remember the inner ear or nerve issue. If it's neonatal, in those predisposed breeds, genetics is the prime suspect.
Right.
For acquired sensorineural damage, we're looking at things that harm the cochlea or the cochlear nerve later on. That includes infection spreading inwards, tumors, physical trauma to the head,
Okay.
and those otoxic drugs and toxins we mentioned. The list is quite broad. Certain antibiotics, aminoglycosides glycosides are key, antiseptics like chlorhexidine if the eardrum's ruptured, some chemotherapy agents, diuretics, heavy metals, and others. Even middle ear polyps can sometimes extend and cause sensorineural issues.
That's a lot of potential culprits for the inner ear type. What about conduction deafness, again, the blockage type?
For conduction, the problem lies in the outer or middle ear stopping sound transmission. The big one is otitis, external inflammation, infection, debris in the outer ear canal.
Okay, common ear infections. Yes. And the other diseases of that canal, like narrowing stenosis, tumors blocking it, or a ruptured eardrum. And then otitis media infection or inflammation in the middle ear space behind the eardrum is a direct cause too.
So keeping ears healthy seems pretty crucial for preventing at least some types of acquired deafness.
Absolutely. Chronic ear disease is a major risk factor.
Okay, so summarizing the main risks. Having Merle or piebald genes, especially double Merle.
Yes. Having a lot of white in the coat linked to those genes.
A history of chronic ear infections, outer, middle, or inner.
Correct. Using potentially ototoxic drugs, especially if not needed or used improperly.
And you mentioned anesthesia sometimes.
Yes, general anesthesia is listed as a potential, though less common, risk factor in some cases. The mechanism isn't always clear, but it's something reported.
Right. Okay, so if an owner suspects hearing loss, maybe they see some of the signs we talked about. What happens next? How does a vet diagnose this?
Well, the first step is usually a good history and physical exam. When did the signs start? If it's very early in a predisposed breed, congenital is high on the list.
Makes sense.
If the animal has a history of taking ototoxic drugs, or just had anesthesia, or has suffered from bad ear infections for years, that points more towards an acquired cause.
And you need to make sure it's actually deafness, not something else.
Exactly. You need to rule out other reasons why the animal might not be responding, like cognitive dysfunction or even certain brain diseases, though that's less common for just lack of response to sound.
What about tests, blood work?
Routine blood tests, biochemistry, urinalysis, they're usually normal if it's just deafness.
Okay.
But if an ear infection is suspected, then specific tests are key. For otitis externa, taking a swab for cytology and bacterial culture and sensitivity testing helps choose the right treatment.
To know which antibiotic to use.
Precisely. And if middle ear disease, otitis media, is suspected, the vet might perform a myronotomy. That involves making a tiny hole in the eardrum to collect fluid from the middle ear for culture.
Okay. And imaging. Can you see deafness on an x-ray?
Not usually. Standard x-rays of the skull aren't very good at showing the fine details of the middle and inner ear structures.
So what's better?
Advanced imaging, like CT scans or MRI, they are much, much more sensitive for detecting diseases in the middle and inner ear. Things like inflammation, fluid buildup, bony changes, or even tumors that could be causing the hearing loss.
Right. CT and MRI give that detailed picture. Are there tests that measure hearing directly, like a hearing test for pets?
Yes, absolutely. The gold standard is called the Brainstem Auditory Evoked Response Test, or BER.
BER test. Okay, how does that work?
It's pretty clever. Tiny electrodes are placed on the skull, and little earphones deliver clicking sounds to the ear. The test measures the electrical activity generated by the cochlea and the auditory pathways up through the brainstem in response to those clicks.
So it tracks the sound signal moving through the system.
Essentially, yes.
Yeah.
It's very reliable for confirming deafness, even if it's just in one ear unilateral or if it's only partial hearing loss.
Can it tell between the two main types, conduction and sensorineural?
Often, yes. By using a special attachment called a bone conductor, which sends vibrations directly to the skull bones, bypassing the outer and middle ear, we can sometimes differentiate. If they hear with bone conduction but not air conduction, it suggests a conduction problem.
Yeah.
If they hear poorly with both, it's likely sensorineural.
Ah, clever.
The BAER test can also estimate the hearing threshold, like the softest sound the animal can detect.
That sounds very comprehensive. What about the other test mentioned, OAEs, otoacoustic emissions?
Right, OAEs. These are actually sounds produced by the inner ear itself, specifically by the outer hair cells in the cochlea as part of the normal hearing process. They're very faint sounds.
The ear makes sounds.
It does, and we can measure them by placing a tiny sensitive probe with a microphone just inside the ear canal. There are a couple of types used in dogs, TOAEs and DPOEs.
And what are OAEs good for?
They're particularly useful for screening for congenital deafness, especially in puppies, because they directly assess the function of those outer hair cells, which are often the first things affected in hereditary deafness linked to pigment genes.
No way.
But, importantly, OAEs won't detect problems deeper in the pathway, like issues with the inner hair cells, the nerve connections, or the auditory nerve itself. So you could have normal OAEs but still have some forms of deafness.
So BAER gives the bigger picture of the whole pathway, while OAEs are more focused on one specific part of the cochlea, the outer hair cells.
That's a very good summary, yes. They test slightly different things.
Okay. Now, what about the actual physical changes? If you were to look under a microscope, what does deafness look like in the ear, the pathology?
Right. In congenital deafness, particularly the type linked to pigment genes, the key finding is degeneration of that stria vascularis, the battery pack.
Okay, it breaks down.
Yes. And following that, the delicate sensory structures within the cochlea, like the organ of Corgi containing the hair cells, tend to collapse and degenerate too. Though the bony shell around it all, the labyrinth, usually stays intact.
So the internal soft tissues degrade.
Pretty much. For acquired deafness, the findings depend entirely on the cause. If it was chronic otitis, you'd see signs of inflammation, maybe scarring. If it was a tumor, you'd see tumor cells.
Makes sense.
And if the cause was ototoxicity, those damaging drugs, you typically see specific patterns like degeneration of the sensory hair cells themselves, sometimes loss of the nerve cells they connect to, and often damage to the centria vascularis as well.
So that stricture vascularis seems really vulnerable, whether it's genetic or from toxins.
It's a very metabolically active tissue, so yes, it seems quite sensitive to disruption.
Okay. So diagnosis is made, we know the type, maybe the cause, what can actually be done. How is deafness managed or treated?
This is where managing expectations and owner education is absolutely crucial. Owners need to understand it, especially with congenital deafness. It's usually permanent. But deaf animals can live happy, functional lives. It just takes patience, specific training methods.
Using hand signals, maybe vibration collars.
Exactly. Visual cues, tactile cues.
And
increased safety awareness is paramount. They can't hear traffic, other animals approaching, dangers. So they need protected environments. Leashes outdoors, fenced yards.
that's critical. What about medical or surgical treatments? Can hearing ever be restored?
Well, surgery isn't really for congenital deafness, as that damage is irreversible. Surgery comes into play mainly for acquired causes.
Like fixing the ear infection.
Precisely.
Mm-hmm.
If chronic otitis externa or media is causing conduction deafness, then appropriate medical or surgical treatment may be cleaning the ear canal thoroughly under anesthesia, or more complex ear canal surgery like a TECA, total ear canal ablation, in severe cases might be needed.
And could that improve hearing?
If it's conduction deafness purely due to the infection and blockage, then yes, resolving the underlying ear disease might lead to some improvement in hearing. It depends on how much permanent damage has already occurred.
Okay. What about those cochlear implants you hear about in humans? Is that a thing for dogs?
It is being explored, yes.
Mm.
Cochlear implants have been placed in some dogs, primarily for severe to profound sensorineural deafness. They bypass the damaged hair cells and directly stimulate the auditory nerve.
Wow.
But the data is still quite preliminary. It's a very complex, specialized surgery, requires intensive post-op training, and it's extremely expensive. So it's not a common or readily available option right now.
Right. More experimental at this stage. What about medications? Anything you can give to fix hearing?
Sadly, no. There are no medications that can reverse existing sensorineural deafness, especially the congenital kind. If the deafness is related to an active infection, then yes, medications like antibiotics or antifungals are used, but they're treating the infection based on culture results, not directly restoring hearing that's already lost due to damage.
Got it. Are there important precautions owners should be aware of, especially if their pet might be at risk?
Definitely. We touched on ototoxic drugs.
Mm-hmm.
Things like aminoglycoside antibiotics
Mm,
should be used very cautiously, if at all, in animals with pre-existing hearing issues or kidney problems, as they are often linked.
right.
And a really important one, never put topical medications or cleaners into an ear canal if you suspect the eardrum might be ruptured. Those substances can get into the middle and inner ear and cause severe damage, including deafness. Always have the eardrum checked by a vet first.
That's a crucial safety tip. What about follow-up? Do deaf pets need special monitoring?
If the deafness is stable, maybe not specific hearing monitoring. But if they're being treated for ongoing otitis, then yes, regular vet checks are needed to manage the ear condition effectively.
And the main long-term things to manage are the safety and training aspects.
Exactly. The biggest complication, if you will, is ensuring the deaf pet can function safely and happily in a human world that relies heavily on sound. It requires commitment from the owner to provide that safe environment and appropriate communication.
It really emphasizes the owner's role in adapting to the pet's needs. Well, this has been incredibly thorough. We've covered a lot of ground.
We certainly have, from the basic types, sensorineural versus conduction, to the really strong genetic links with coat color.
Right, and all the different ways hearing can be lost later in life.
Yeah, the acquired causes, the diagnostic tests like Bay ear and OAEs, and the management strategies focusing heavily on adaptation and safety.
It really paints a picture of just how complex hearing is and how many things can potentially affect it in our pets, something we probably take for granted.
Very much so.
So, as we wrap up this deep dive, maybe a final thought for everyone listening. Considering the wide range of acquired causes we discussed, infections, toxins, trauma, what proactive steps can you, as an owner, realistically take throughout your pet's life to help protect their precious sense of hearing?
That's a great question. Really brings it back to preventative care and just being informed and vigilant as a pet owner.
Absolutely. Well, thank you so much for sharing all this detailed insight today. It's been incredibly informative. We hope this exploration has given you, our listeners, a much deeper understanding of deafness in dogs and cats.